Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host Gurdeep Singh Sandhu. My clinic address is 7021 Village Parkway, Dublin, California 94568, and my phone number is 408-687-1899. Email address homeomedicine HOMEOMEDICINE @yahoo.com. So, anytime, if ever you want to consult me regarding any disease, when you are tired of any disease, any treatment at any age, call me for second opinion of your disease. And if ever you want to be treated by homeopathic system of treatment, a scientific approach to your health, you can call me at 408-687-1899 or send your concerns on email homeomedicine @yahoo.com HOMEOMEDICINE @yahoo.com. So I'm here to deliver the second lecture of Health Education Lecture Series. And in this lecture series, we are discussing life from life, how this life is created from life, and ultimately, what were the complications during this course journey of the life. And we are at the point now that the child has been delivered and now it's free from mother, definitely, separately. And now, after that, what complications he may have at this time and how we should take care of all those complications. We are discussing this in these chapters. Yesterday in Punjabi, and we have already discussed about all those what we have discussed lately in previous lectures regarding the newborns complications. And after that, today we will discuss about the toddlers complications, and then we will go to the diseases of the children's. So diseases of the children's, mostly you can say the toddlers mostly had low weight. Why there be low weight? We have to find out the reasons behind that. I can first of all calculate the things which we have to discuss today. The first thing, low weight of the toddler. Second, malnutrition or non-lactating mothers, especially overeating or regurgitations. Then water deficiencies. In not lactating mothers, especially. Next, some of the signs which may appear because of the outside infections, because of not taking hygienic measures for this newborn, which he needs urgently, because his immunity is not developed to the extent as the adult persons are having. It means we need to take a special care of the newborn toddlers so that he should not suffer from any unhygienic type of problems. And if ever he has, how to treat that, we have to tackle with this one. And after that, overcrowding and kissing, hugging, all this. Sometimes this becomes the complications for the newborn, as we have already discussed. The immunity of the newborn is not sufficient to cover up, to combat with the all infections which may take from the other relatives who are coming to see him, to kissing him, to hugging him, all that. In this way, all these restrictions should be put on so that he should be saved from all these inevitable conditions in his life, and may be saved from those things. Also, the sleep pattern we have already discussed yesterday, and today again I will discuss the sleep pattern. After that, basically with the sleep patterns, we will discuss the priorities. Priorities should be given to this toddler stage of the child, and keep patience. Keep patience so that you should not be irritated, because if your body needs rest and the child at this that time wants to play, or child at that time is suffering from some of the conditions, just like rashes or any other type of infections, under those conditions there is no question of your rest, and you have to give the priority to the newborn at this stage, so that his problem should be tackled in priority. Mostly in toddler conditions, not only in toddlers, but even in growing children's, ear infection is a very prevalent infection, and most of the children suffer from that. The folly is that we go to the doctors with the children, they check their ears and they say, no, there's nothing. If there be no discharge in the ears, they say, no, there's no problems. Sometimes they check the drums and they say, some fluid seems to be in the back of the drum, tympanic membranes. But actually, we have to treat the cause of this one. And before treating, we must understand the cause of this repeated ear infection, and how we can diagnose this thing that the child is having ear infection. So, all these things and some of the trivial infections, trivial viral diseases may come up at this periods, that you have to take care of that. So let us discuss one by one. Low weight. Why there is a low weight of the toddlers? As I told you, when the child is born, it is assumed it is 7-8 pound approximately at the time of birth. But during this periods, as you noted previously, that during labor, about 17 to 20 hours, he was not getting proper food, not in the mother's womb, and even after delivery, immediately he is not getting any sufficient food at that time, which may cause low weight. Second, child was surviving on mother's blood, but if the RH factor is a different of the father and the child is a male child, mostly if the child is male child, sometimes he loses weight after birth. And this happens in the first 3 4 days. First 3 4 days, a child loses weight because there is not sufficient, you can say, in the liver, uh, glycogen, which makes the further glucose to be distributed in blood to make the further blood. That's why deficiency of glucogen, because he was not getting food from the intestines. In thus conditions, children's toddlers lose weight in the during the, you can say, the first 40 you can say days, or whatever, the 6 weeks. In this way, we have to take care of the child because now he's weak. He has not taken sufficient food, and if he is not taking sufficient food, the immunity is not growing as it should grow, and he is becoming weak day by day. This should be tackled. These losing weight condition may be associated other than this factor, that mother is not having sufficient milk in her breast, so that the child can be provided the sufficient meal whatever he needs. Under those conditions, you need to give him an artificial food, formula foods, or goat milk, or all that. But sometimes what happens, this artificial means they are not accepted by the enzymatic system of the toddler. Under those conditions, this is not accepted. Means, when we say this food is not accepted, means the enzymes to digest that foods are not prepared, are not established inside the GIT, gastrointestinal tract. Because gastrointestinal tract naturally has a power that if ever your meal is a carnivorous, it will start producing similar type of enzymes which can digest meat. But if you totally change your food from the carnivorous to herbivorous, means vegetables, fruits, just like the routine peoples, we do that. Then the system, GIT system, gastrointestinal tract, our digestive system, it starts producing similar type of enzymes which can digest the carbohydrates and the fibers. Meat is a protein with less fat, though there is fat. And therefore, when you apply artificial food to the newborn's toddler's age, he do not accept it. And at that stage, uh, enzymes are not prepared. When the enzymes are not liberated, then this food is going waste. Maybe the child is having vomiting, child is having diarrhea, and all other undigested indigestions, undigested food materials, or indigestion features, symptoms in that. And regularly, if these symptoms are not tackled, he may be losing weight because proper food is not given even after birth and is not being assimilated. Means from your gut, from your intestine, it is not absorbed to the formation of blood. Whatever the procedure, I will tell you later on what's the procedure, how our taken food inside becomes blood. I will let you know later on when the chapter will come to that stage. At this stage, you just learn only that if the child is not given proper food, or child is given food but that is not acceptable by one or the other reasons. Maybe the enzymes are not preparing, system is not liberating those kind of enzymes which can digest the type of food you are giving to the child. So, all these things, why a child is losing weight, we should consider, we should find out the causes behind that. And then, if we find out the causes behind that, definitely we will be able to treat that. Because it's a purpose of management. This is a purpose of management. You have to manage. You can manage only if you know the reasons, if you know the obstacles. And in this way you must know that my child is losing weight, even I'm giving him proper milk. Your proper milk may not, if mother is not having sufficient that quantity of the minerals and vitamins whatever is required, her milk himself herself will not be sufficient to produce the desired value of the food. Means calcium, potassium, minerals, and all that will not be provided with that. Even she is giving her milk. And the other thing we have considered, you are giving some artificial foods, or you are giving the totally for non-lactating mothers. Mother is not giving his food, not giving his milk. Totally, the child is dependent upon the outside food, and when it's dependent on outside food, it's a but natural that immediately child do not accept that food. Accept means the system has not liberated that kind of enzymes which can digest this change of diet. In this way, we have to repeatedly. This is a thing of adjustment, adaptation. This is known as adaptation. Means when we go at a new place, we try to adopt according to the environment, according to the food, according to everything over there, and we adjust over there. And this is known as adaptation. Same way, the child has come out of mother at this time, and everything for him was done by the mother, and now he has to do himself. Now his system has to do himself, which was ready to work. But at least, at least, if the system is okay, it will take some time under some conditions that your given food will not be adjusted, digested immediately. It may take time. So, if it may take time, definitely you have to wait till then and watch if there be any serious conditions coming out of this imbalanced diet, that is diarrhea or vomiting, and again further declining of weight. If with your measures declining of weight has stopped, it's okay. You can continue with that one. But even if with your different kind of food you are trying to avoid the previous food which was not suitable to the child, or his gut was not accepting that one, even then you have to watch it. That is the known as period of 6 weeks. All these things happen within these 6 weeks, and in these 6 weeks child learns or adaptation accepted according to the new food and new environments. Under those conditions, you should be patient and learn what changes are coming day to day in your children regarding their routine respirations, vision, ears, and all excretions. Excretion means stool and urine. You have to watch all these things. That if everything is going normal, it means adaptation is going on its way. But if stool has changed, if urine has changed, if indigestion persists in the shape of diarrhea or in the shape of vomiting, and because of all these things, child is losing weight, then it means the adaptation is not going underway. Adaptation is underway, it is not according to the limits we can accept. Then you have to change. You have to change the meal, food, whatever you are giving to him. So that and measurement is that if the child is not losing weight, is standstill, it means adaptation is going in process. If the child is losing weight with your changing food, it means adaptation is not properly adopted by the children. Then you have to change that everything. Malnutritions and sequence of food. As I told you, that the capacity of the newborn children is only 30 milliliters, 30 cc, you can say approximately 30 cc in the stomach. Means one time if he will suck milk, swallow it, it's only 30 milliliters. And gradually, day by day, it increases. And if without knowing this capacity, and at the end of the week, it comes to 250 ml. And if it goes in this way, then you have to follow this pattern. But without following this pattern, you are giving him milk, though it's a mother's milk. You are giving him milk, he's sucking it. Ultimately, indigestion will occur and he will vomit. Curd vomiting is indicative of the enzymes are prepared, and also regurgitation is indicative of if he is vomiting green, that means the biles is also coming with this food, with that milk. Curd milk, offensing sour, and also green in color, all these things indicate that whatever food or milk you are giving to the child is not acceptable. You have to break, even if it is his own mother's food. And the one reason I already told you about the RS factors. Father's factors was different, mother's factor was different, but there is no problem in female children. There is problem in male children, but everything is overruled. Even then, even then, a child is losing weight, then you have to follow the certain rules has been established by the medical science, that the capacity of the children's in the beginning is 30 milliliter, but repeatedly cycle is repeatedly. Listen, our heart rate with which everything comes into circulation is 72 to 80 per minute. Whereas when the child is born, his heart rate is 140 per minute. 140 per minute means circulation is too fast. Everything is going too fast into the circulations. And repeatedly, it is advised that you can give small quantity of milk, whatever you are giving, and you have to repeat it every 2 hourly. That's just like we take 3 meals: breakfast, lunch, and dinner. Sometimes some people take only 2 meals. Some takes 1 meals. It depends upon the calories you are you receiving or you need to receive, or your body needs to work continuously. But the child is lying down, and for that purpose, you should be understanding the condition of the child which is newborn. That is why this specially has been added, that you should keep patience. Mother is tired after delivery, and even after that, the sleep pattern is different of the newborn, and mother is also tired, and she want to sleep that, and ultimately she try to give him excessive milk so that he can sleep for a longer period, but not. When you do this one, just to avoid our time, just to take more rest and be free from the responsibility of the children, under those conditions your child will suffer from the indigestion. And the condition of the indigestion, I have told you, first of all, in normal conditions there will be vomiting of milk. Second condition, there will be you can say thick milk. Third condition, the vomited is sour. Fourth condition, the vomiting is with green bile. Offensing sour is a bad conditions. So these are the stages you have to follow. And you have to obey the indication of these stages and manage your child accordingly, not to give him more food at one time, but give him food repeatedly in a small quantity time and again, so that the child should not have. Second thing, we have already described it, but even then, it's necessary. Most of the mothers give milk to their children at this age when the child is lying and mother is lying on the bed. And what happened? There is no limited quantity when the child is sucking your milk. And it depends upon the mothers that how much milk is coming in her breasts. Child continues sucking. And ultimately, after sucking, he stop and sleep. And also, you think now my child is full, and now you also go to sleep. In these conditions, regurgitations occur. Regurgitation is normally occur. And if there is a regurgitations, child is sleeping, mouth is closed, that overflow of fluid, you can say, the overflow flow of the milk will come into the mouth. And in your buccal cavity, this mouth, the whole area inside your mouth is known as buccal cavity. And in this buccal cavity, there are 7 different openings. Some of them are covered by the membrane, some of them are directly open to the outside, just like the nose. Nose is open outside. It's also open into the buccal cavity, the mouth. And eyes. There is a membrane in a hole to pass the optic nerve by which we can see that and perceive what we are seeing. But that is covered by the membrane. Ear, 2 ears, 2 nose, 2 eyes, 6. Seventh, mouth. Mouth is also open outside. And sometimes forcibly regurgitation, food or milk, clotted milk, curd milk. It comes out of the mouth. And also it pushes pressure in the back side of the ear, in the back side of the eyes, and also in the mouth. And sometimes it may come from the nose as well. And if the respiratory passages are closed, blocked, you can say, the better word is blocked with this regurgitation of milk coming from the stomach outward, sometimes it may create a serious condition. And I told you yesterday that there is a one condition which is known as sudden death. Sometimes the child are sleeping healthy, normally taking food and everything, and mother is unaware of the conditions. After that, she is also sleeping. and child regurgitates. Child regurgitates and his respiratory organs are blocked. And sometimes this regurgitated milk go back into the respiratory organs because there is a one junction, epiglottis, where food pipe and the respiratory bronchus are united. There is a valve, automatic valve, shifting valves. If you are breathing, one valve is open, which allow the air to go into the lungs. The other valve, which allow the food to go into the stomach. And now there is a forcible expulsion of the milk which the child has taken, and you are sleeping. Under those conditions, some of the milk, because the mouth is closed, it will put pressure into the nose, may come out of the nose. Nasal passage is blocked. If the mouth is not open or open, some of it will come out of the mouth. Others will put pressure on the ears. Especially in case of toddlers, there is a ear infection because they are able to move. When there is a vomiting, when there is a regurgitation of food or milk, they are able to move at the toddler condition. In the newborn stage, they are not. And after about 28 days, they are able to move. Under those conditions, they can move and they can survive. But if repeated regurgitation conditions are occurring with the same child, sometimes it may block your air passages, and ultimately sudden death. Suddenly means mother is sleeping, and when she awakes and find out the child is dead. So to avoid all those conditions, it is advised that during the toddler condition, means the first 40 days, 6 weeks approximately, normally 6 weeks we consider. Purperial period. This is known as purperial period, and in Indian community we take Shila. You should be attentive. If you are not attentive, somebody else should be attentive. 24-hour vigilance is necessary up to the 40 days, this period, because anytime anything can happen, can block the respiratory passages. Child is unable to safeguard himself. Suppose if I am having regurgitations, I will wake up, I will rise up on the beds, I will throw up outside. But he is not unable to do this one. Under those conditions, 24-hour surveillance should be there for the toddler children, so that no one should suffer from all these mishappenings, you can say. And same thing. If this thing is continuously, repeatedly happens with one child, ultimately it pushing pressure in the buccal cavity, and the ears on the back side are blocked. Where there is a junction of the ear at the same position, there is a tonsils. There is a tonsils. In the back side of the tonsils, there is a junction of our ears, outside the pinna and inside the tympanic membrane. And that also is composing a big stuff of the milk, curd milk, thick milk is deposited on that areas. And ultimately, sometimes you will see the children are unable to listen even at the age when they should listen. And sometimes a redness of the eyes, and sometimes children we see they cannot see. All these things happen because of indigestion, which was not taken care properly by the attendants or the mother. Therefore, this is the important thing, the repeatedly ear infection. When it comes with the indigestions, child rub his nose. This is the indication. Though the milk is not coming out from the milk, child continuously rub his nose. Child continuously rub his ears. It indicates, though milk is not coming out, it indicates that there is indigestion and you should be alert at that time not to give more milk at one time. Or you can save your child in these conditions. And this thing, when a child grow more after that 40 days, after the 40 days, the time is over, and child sometimes do not have an estimation how much milk he should take. You should be curious about that one. Not the full bottle at one time. 50 ml, 40 ml, all these things should be given gradually, should be increased. But if you have given more milk, more food to him, and continuously you are doing the same thing, perhaps thinking in mind that your child will grow bigger very fast. It's not. Child will grow bigger very fast if everything will be digested and converted into the blood. Then he will grow. Uh, Bones will be supplied the sufficient food and calcium every day. The muscles will be supplied the sufficient fat and everything. But if that food which you are giving to him is excess and is not converted into energy, then this is a wastage of food. This is not going to benefit anyway to your child. And most of the childrens, when the mothers give them milk, they suck their mother's milk from the breast, and my mother is sleeping, child is lying. Ultimately, this type of regurgitations happens very frequently. That is why it is advised in all conditions that whenever you are giving milk from your breast to the child, or even from the bottle milk to your children, you should be sitting on the bed, and head of the baby should be raised high near your breast. Means it should be high, and there should not be a chances of regurgitation even at the same times. And after that, it is advised that a child, after giving milk, every time we should we should help him to burp and eructate, so that the extra air, whatever is there, should come out, and it should give space to this milk, and ultimately milk will be pushed downward into the stomach. And there are different type of you can say doors. From the stomach upward there is a cardiac orifice, and from that one, above there is a diaphragmatic openings, and above that one there is a, in the throat, epiglottic type of openings, epiglottis openings. And all these openings are opened with forceful regurgitation of the milk. You can well imagine how big force is used to get that milk out. It's nature's automatic process, that the nature is not accepting, your body is not accepting that much milk which you have given, and she want to expel it out. And with force, it opens three type of doors from the stomach upward. And that forceful expulsion of your milk, of your food you have given to your children, is a type of poison. Therefore, it is advised to all the mothers that they should not give more milk at one time. They should give repeatedly milk of small quantity. And also, the burping is the main point, that after every sucking of milk, child should have burp, so that you should be sure that the milk he has sucked has gone into the stomach. And now three doors are closed upward. And it should not be in excess of quantity. It should be in the normal quantity, which is acceptable by the stomach, which the stomach can digest. So, in this way, If all the mothers follow this rule, their children will not suffer from the tonsillitis. Their children will not suffer from the ear infection repeatedly, and ear infection with the fever and all that, and also rhinitis, flu type symptoms. There is no anything else from outside. We have not yet reached to that extent. But because of this overeating, over food, he is regurgitating, and the inside the regurgitated material is having enzymes in that one, acid, pepsin, and that the bile, also the insulin sometimes may come up from the duodenum to the stomach, from stomach to upward. That may cause problem. And also the losing of weight. In spite of increasing the weight that you are giving more food to your children, he will decrease the weight. So that should be taken care of, and you will save your children from all these problems. Rubbing the nose is an indication for you, and rubbing the ear is an indication for you. Rubbing the eye is an indication for you. Coming, if you open his mouth and you see thick milk on the tongue of the children's, it's indication for you that you should cut down the milk which you are giving to your children. Take time. Give him time to digest the previous one. So all these things are the open indications for you, so that you can safeguard your children from any incidents. After that, I told you about the sleep patterns. Sleep pattern, children's sleep pattern is a different from the mother. Most of the children's in the mother's bub, they sleep according to their own pattern. That is sleep pattern, that's known as circadian system. Circadian system is attached to the pineal body, which is situated small gland like rice, small gland like rice in the base of the brain, which is known as pineal body. And pineal body is also known as third eye, which has relation with the nature outside our body. What's going on in the nature? Stormy weather. We suffer from the stormy weathers. Rainy weathers. We suffer. Some of people suffer when when there is rain outside and they are sitting inside. And there is a daylight. There is a night. According to the when there is a night, we go to bed. Automatically, we go to sleep if we are not sick. And the same way, when there is a daylight, that's produced by the nature, by the that nature means the circulation of the earth and the sun and whatever. But the pattern is maintained by darkness and by the daylight, and that darkness and daylight is followed by the pineal body in the base of the brain. And in the mother's womb, the child at 20th week of pregnancy follow or set up its own circadian system. And sometimes the mother during pregnancy say to the doctors, doctor, my child is not moving. Long time he has not moved, because the sign is known as kicking. When the child is moving inside the abdomen of mother's womb, it is known as kicking or quickening. But if now the mother is addicted to that one, quickening or kicking of the children, he is moving inside that. But sometimes when a child is not moving for many hours, the mothers are worried, my child is not moving. But you must learn this thing, that it's nothing to worry, because the children have set up its own pattern with the circadian system, means the third eye in the base of the brain has been established and is working with the nature, though it is under many covers. abdominal wall of the mother, uterine wall of the uterus, and amniotic sac inside the uterus. And so many covering. Even then, that pineal body works according to the nature, darkness and the daylights and all that. But in the mother's verb, it has a different pattern to accept the circadian system, its own individual pattern, which is separate from that. Just like I told you, our environment pressure is a 480 millimeter of mercury. Always this pressure is on us, which maintains our weight and everything. But in the mother's verb, that child is not having that much pressure. That pressure is not exerted on that one. And when any body part of the fetus come out of mother's verb, that weight is put on that. That is exerted. And then the child has to behave according to this environment. But we are talking the circadian system, that now, even after birth, the mother says, my child is not sleeping well because his pattern is still adopting the new environment. He's newborn. He is within the 40 days of your life, and he is still learning. He is still adopting the pattern of this environment and this pressure, and the circadian system is still working according to its previous setup in the mother's verb. So, under those conditions, he sleeps according to his own mood. He sleeps according to his own pattern setup inside. Gradually, he learns. This is known as adaptations. Gradually, he learns, and then when he learns all these things, he sleeps according to the mother. Though he wake up one or two times at a night, but mostly after 40 days, children learn to accept this environment adaptations, that they sleep most of the night time and they wake most of the daytime, but they sleep because their sleeping hours are at the time of birth, their sleeping hours starts from 20 hour onward. Then the sleeping hours are reduced. Sleeping hours are gradually reduced, and when this 40 weeks are this 40 days are over, 6 weeks approximately, when they are over, it comes to about 10 to 12 hours. 10 to 12 hours the child sleeps. So then it is mother who has to adjust his sleep according to him. But even then, during his sleep, you should be attentive of any regurgitation may not occur to your children, may cause any complications. In these conditions, you should be careful there. Means his grievances should be given priority, not yours. And that's why in Western countries, mostly people, the couples, do not give birth to the children's more, mostly one, maximum two, because they do not have any support. They have to do the job, they have to go for jobs and all that. Even if one person is working, even then they one lady cannot take that much stress and to be awake 24 hours. It's difficult. In this way, people mostly avoid, if they are not having any grandparents, not not to give birth to children. So under those conditions, to save your children from ear infections, from any type of infections, you should be careful of that. And last thing, but not the least, there are many more other things. Diaper rash. Immunity of the child is not of that extent that it can save himself, or the skin is healthy to the extent, just like we are working in the mud and there are many more bacteria inside the mud. but we do not have any problems with that one. Even in our environment, many more bacteria as viruses, they are floating inside the air. We are breathing in that air, that's touching to our body parts, but we do not suffer. But the child, this child is a sensitive, is not having sufficient immunity to fight with this environment's infections. In this way, you have to take care. As you know, in our intestines, in our intestines, there are different kind of thousands of bacteria, parasites. They are living in our gut, in our intestines, for taking care of our intestines. Just like there is the ponds, religious ponds, you see the fishes are there just to safeguard the water, purification of the water, that all the things should be taken out by the fishes. In this way, for our intestine, we eat food, go into the intestines, it fermentates, it forms gas, and with the gas, our abdomen should not burst. To save this type of condition until it goes out, to save this kind of conditions, nature put many type of bacteria inside our gut so that they can swallow those gas and convert it into normal conditions. Just like acid converts, neutralize the alkali neutralize the acid. In the same way, these different kind of bacteria are saving us in the intestines, and they are also coming with the stool as well. And those type of things continuously, if you are not wiping up temporary and timely, and this stool of the newborn or the toddler remains in contact with the anus for a longer period, or the thigh in the buttocks in the longer period, that may cause rash. And then you have, the child has to suffer, he will cry. His hand may not go up to that area, just like the nose and eyes and ears, but it will cry. His language is only cry. It's up to the learned mother, it's up to the learned physician to understand the language, interpret the cry of the children, that what may be the cause of his crying, so that he can take care of this one. Whether he is having ear infection, whether he is having rhinitis from the nose, something, or any eyes infections, or sometimes maybe diaper rash, or sometimes maybe UTI, urinary tract infection, as I told you about the prepuce, which is covering the glans penis. Sometimes the drops of the urine remains inside and they attract the bacteria. That's known as smegma. And smegma attracts the bacteria, and the child has UTI, irritation, itching. Though his hand reaches up to that one or not. If reaches, he crushes that one. But if not, even then he cries. So we have to learn, interpret the cry of the children, so that we can take care of the child properly. What he has, what the problem, why he, whether he has to need food, milk, whether he has to urinate, whether he has to do potty, whatever, all these things we have to learn properly from his cry. And this is the sign of a good mother. And if a mother learns all these points, then definitely she can save the children from any other infections, and also from all the diseases which at this stage a child can suffer. One more thing, and the last thing, today's lecture. When there is a newborn at any home, generally the neighbors, relatives, they come to hug, they come to kiss. So, all these things, you do not know about that one. Who one is suffering from what type of infections. And this child is a clean slate. Anything you, whatever you will put on that one, it can write, it can put some imprint on that one. Same way, the body or the susceptibility of the children is to the extent that it can accept any type of sign, any type of infection, any type of environmental things. That is why you have to save the child and you have to restrict the visitors, strict the visitors, so that they should not repeatedly kiss the children, they should not repeatedly hug the children, they should not repeatedly come very close to the children, especially until you feel the child has its own movements to safeguard. Means after 40 days. After 40, even then, as long as you can save your children from these kind of outside attractions or outside touch with the other peoples, your child will remain healthy and will be saved from the outside influenza or all other type of things. He will not suffer from that one. So today we have completed this condition of the toddlers. We have passing now the 40 days periods, and after that purperial, basically this is an English term, is known as purperial period. This purperial period is a 6 weeks periods, and we in these lectures have given details of these things, that the puerperial period, how this bleeding of the mother stops, what are the changes taking place, if it's not taking according to that, what will be the cause behind that one. All these things we have discussed systematically. But now, next, we will discuss about the diseases of the children. Now, newborn has, that period has passed. Toddlers, that period has passed. Now we are at the stage of children's. At the stage of children's, what type of infection mostly a child can suffer from? One by one, we will discuss these things and what will happen in these conditions, how we can diagnose these conditions, and how we can treat these conditions one by one. We will cover all these things with the next lectures, just like the cough, ear infection. Already I have discussed about that. Step throat, because the same thing from the repeated regurgitations, step throat may occur, and chicken pox, measles, all these things, pneumonia mostly, all these things we will discuss one by one, so that every mother or every parent should know all these things and can save their children from all these dreadful conditions of the children. Today's time is over. I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 7021 Village Parkway, Dublin, California 94568. My phone number is 408 687 1899. Anytime, if you want to consult me, you can call at 408 687 1899 for any problem, from head to heel, for anything. Or if you want to be get treated by homeopathic scientific approach to your health, you can call 408 687 1899. Rabrakha, God bless you all. We'll see you tomorrow. The first lecture will be in Punjabi, uh, and the second lecture will be in Hindi. Today, I have given the full time to the English media, because from the 2 3 days I could not attend the English medias, and today the full time has been, and everything from the back onward up to this level, up to the level of child, has been covered in English, in Hindi, and in Punjabi. And tomorrow, on Saturday, we will be covering, first of all, the radio Pravas will join us at 5, and we will deliver the first part of the children diseases at 5 to 5:30, and after that the same thing I will repeat in Hindi, because after that there is a time for the Hindi. So God bless you all. We'll see you tomorrow, and be vigilant about your health and about your children. Thank you.